I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsey Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsey Vestal. I will link to the group below in the show notes and description. Thank you so much. Hello, everyone. Welcome to OT Empower Hour, where we meet every Thursday at 12 o'clock Eastern Standard Time. We roll up our sleeves and we get curious about how we can continue to grow as OTs in pelvic health. For those of you who have just joined us, there are over 145 replays available pinned to the top of the page. We've been going live for, oh my goodness, over 2 years now. So feel free to binge watch at your leisure. But I have to admit, we love it when you join us live. So thank you so much for being here. This is a special celebratory OT Empower Hour where the team that has been working diligently behind the scenes for the last year is coming together to announce the newest community of practice within AOTA called Occupational-Based Pelvic Health Community of Practice. We are so jazzed up. We are so jazzed up. We are housed under the Home and Community Special Interest section. And I have to admit, I am honored to be surrounded by the incredible team of powerhouse OTs here today. We have Mara Podvey, we have Laura Rowan, we have Tiffany Lee, we have Rocky Srivastava, we have Sarah Siddar, and Kimberly Lennington, and myself. We are going to use our time together today to talk about how this new COP started, our vision behind it, and what we hope to accomplish. So we're going to skip some formal introductions, but I'll invite each of you to introduce yourself in the comments throughout the chat today. And for those of us joining live, and for those of you on replay, you know, Facebook doesn't let us know you're here until you comment, and it absolutely energizes us to know that you're here. So let's kick it off with our icebreaker question. COP team, I'm going to start with you all, and I'll just type your answers in the comments, but everyone joining us, let us know. Let us know your answer too. Oh my goodness, we already have so many people in the comments. Fantastic. All right, Kirsten, Christy, Carlin, I want you guys to answer this question alongside this incredible team joining me today. The question is, Lexi, Kiara, oh, fantastic. I love it, guys. I love seeing your energy. So here's the question. Whether or not you participate or just prefer to watch via spectator, skiing or snowboarding, what do you pick? Laura, let's start with you.
Snowboarding. I grew up skiing, loved it, and my husband did not ski, so we learned to snowboard together, and I haven't gone back.
All right. Mara?
I have to say neither. I am very clumsy. I do my best exercise laying down in a pool. So I'm a swimmer, I do yoga, I walk, but I do not do snow sports. I would be in hospital every day.
Fair enough. Kim, you're up. She may be frozen.
Muted.
Oh, she's muted. All right, we'll come back around to you, Sarah.
So I have been skiing exactly once in my life. I have no basis of, and I think I was maybe 11 or 12. So I have no basis of comparison at all whatsoever. So I guess by default I'll say skiing because I've never done anything else. So
I got you down.
It's on the list of things to do. I would like to go skiing and try snowboarding again. So I'll get back to you when I figure it out.
Update the comment. I have you down for skiing, but you update that comment whenever you're ready. Tiffany.
Let's see, I've skied my whole life. I'm not that great, but we just went in December, and my son snowboards. One of them skied, one of them snowboards, and he looks so cool. I want to be cool like that. So I'm a skier. I can go down, like, I'm pretty slow, but I'm very steady Eddie in anything I do. But I wish I was a snowboarder because that looks way cooler.
Rocky?
I've never done either. I'm pretty solid at snow tubing. It's been a few years since I've done that too. So
Fantastic.
we're kind of a lame group, huh?
That's okay, because we are surrounded by a lot of people joining us. Kirsten says skiing, and I happen to know she's a pretty darn good skier. Kiara says snowboarding. Lexi says skiing. Carlin Rayom says skiing. Carlin, I can't wait to see you next week at the Western Regional Symposium. Christy says, if I were near water, I ski. Definitely no snow sports for this deep South Southern girl. I love it. Well, you guys, I don't know if you know this, but I'm living in Flagstaff, and I have about 50 inches of snow that we've gotten. And this weekend alone, we've gotten 20, and the kids have been home all week. So I am very excited to be joining you all today.
And
All right,
Kim,
without
what about
further,
Kim?
oh, Kim, yes, please.
Yeah, I got unmuted. So if you can't hear me, sorry, but I think I'm on. I'm tried and true Southern California girl, and I don't do either. So give me a water sport and I'll do it all day. But yeah, not so much with snow sports yet. I like the tubing, Rocky. I'll join you on that.
Love it. I love it. All right, let's get into the content today, because we are so excited to share the vision and the background and what we're thinking about this COP. And we'd love to hear from you all throughout the conversations. Why we love having you live, but if you're on replay, of course, we want to hear from you as well. So, Mara, what is a COP? For those of us who aren't familiar with this AOT lingo, talk to us about what it is and kind of how it fits into the bigger picture at the AOTA.
So a community of practice is a learning community. It's not a work group that makes products for AOTA. It's not a group that really focuses on advocacy, although advocacy can be an outcome of a community of practice. It's really a space where like-minded practitioners can meet and learn together. AOTA has the SIS, the special interest section, part of your membership. So if you're a member of AOTA, you have to be a member of AOTA in order to be a member of special interest section. But when you sign up to be a member, you can choose special interest sections that are of interest to you. So you can learn a little bit more about, say, home and community health or rehab and disability. Depending on where you work and what your interests are, you can hop into one of the SISs to be more available for the programming that they have and the learning opportunities that they have. Now, the communities of practice grew out from a desire for AOTA to hear more of what their members wanted to learn about and where they wanted some support. And so the community of practice concept with AOTA was started really in 2018 in order for people who are members who have a special particular interest in one area or other to create this learning community where members can meet on a monthly basis virtually so that we don't have to be local to each other, to learn together and to network a little bit. So we don't have to keep reinventing the wheel in whatever area of practice we're in. If we're talking regularly with people, students, scholars, new clinicians, seasoned clinicians, everyone together can learn together and learn from each other. So each special interest section hosts a number of communities of practice. So depending on which community of practice or which SIS you are a member of, you may have gotten some AOTA mailings or emails about certain things that are happening. But there are a number of communities of practice in AOTA. Myself and Kimberly Lennington were the co-founders of the Women's Health Community of Practice. There's also one on autism. There's one on rural practice. And there are many, many others, which I encourage you to check out because you can be a member of as many communities as you want. And you can learn with your fellow practitioners. If you and another member of your learning community decide you want to work on something together, you can go off on your own from having networked together in a community of practice, and you can create something on your own, separately. If it's an article for an OT practice, anyone can submit for that. But the benefit of the community is that you're with like-minded people who have like-minded interests, and you can learn together, and you can then go off and collaborate together in any way that you choose.
Excellent, Mara. Thank you so much. What an incredible overview of SAS's COP. It's a lot of alphabet soup. So we really appreciate you breaking that down for us. And yeah, big kudos to you and Kimberly for starting the original Women's Health COP, which we're going to talk a little bit later about how that's different than what we've started today, but you definitely paved the way for us. Thank you so much. Laura, we'd love to hear from you a little bit about sort of like the vision and the reason for this new occupation-based pelvic health COP.
Yeah, absolutely. The reason I brought Mara and Kimberly in on this is because they know, I didn't know. I was looking for a home. I was looking for a headquarters and a place, and they taught me the structure and the outline and the language to be able to put this into action. So thank you for that. And for continuing to be such a great resource and guide for us. But essentially, I had no interest in AOTA for many years, especially as a pelvic health OT, because there just wasn't anything for me, right? My girlfriends would always talk about going to conference and how much fun they had. And I was like, I want to go, but I don't really want to go to conference because there's nothing I didn't have a community. I didn't have a network. And then I was like, wait a second, I'm going to bring the pelvic health to AOTA. And once that kind of seed was planted in my mind, then I was like, you know what? I think we really need to build on this. And, we are so strong in our community, especially like in this Facebook group community that you've built, Lindsey. And, being able to bring it to our national organization to get their understanding and support, because especially being at conference, it really made me realize that there's just still a lack of education and awareness amongst our own profession. Yes, we can do this. We are great at this. And, I think a lot of my efforts were focused outwardly at pelvic health PT colleagues and physicians and the community to be able to spread the awareness. And then I realized we needed to bring it home. And that's really where this got founded. I wanted to be able to have some good, strong roots within our own profession, and for our own profession to really understand what we're all about, and then to have more visibility for our students and our new grads and people who would really be able to help fulfill our capacity issue in pelvic health, right? So be able to build more awareness so we can have more of us serving this underserved population. So that's really where it started, was conference. And I, at my first conference, I saw Tiffany Lee. She was already bringing the pelvic health. So that was amazing to see. And then, we just kind of started, seeking out the different key players on how do we get the ball rolling? How do we do this? And, we were hitting real roadblocks, and those roadblocks, I think, just fueled us more and just made it more evident that we needed to be here and be able to explain ourselves. And so, yeah, it's really exciting to go from last year being at conference and having this idea to going to conference this year, and the mission's complete. So,
yeah. Thank you so much for that, Laura, and to this team. I mean, it's an absolute team effort to pull all this together. So that vision and that spark, and then each one of you bringing so much to the table, and this community at large. It's been a year in the making, right? Am I right about that?
Oh yeah.
Yeah. So anyone coming to conference, we hope to see you there, and we'll talk more about all of this. And we're gonna have a special meetup on which day, Tiffany? Which day is our meetup?
Friday at 5.
Friday at 5. Fantastic. All right, Rocky, I would love to hear from you a little bit about who could benefit from being a member of this new COP?
So my answer is everyone. Everyone has a pelvis. I think every OT should have knowledge of the pelvic floor and the functions. I think back to years ago when I worked in inpatient rehab, and I remember walking down the hall with my director one day, and I just said, you know, OT would be so much easier if I could just take a couple years off and solve incontinence. And this is before I had an idea that pelvic health therapy was a thing. So I didn't even know it was an option. My director knew, but she didn't like even connect the dots on like my comment or that maybe I would have an interest in like pursuing this, or, and she was a PT, and, you know, this was probably like 2016, 2017. So, you know, then years later, I read the article about Lindsey and OT practice, and I'm like, oh my gosh, I can do this. That's actually a thing. Like we are solving incontinence. Like, but think about all the different practice settings that would benefit from this. So like the sniff settings, like how many people are in sniff settings because of incontinence and or they had a fall, like going to the toilet in the middle of the night. So bladder and bowel, like this is like universal from pediatrics on. So pediatric pelvic therapists, you know, like they have their place as well. So I don't think, you know, it should be limited to just outpatient therapists by any means, or private practice owners. I think definitely anyone in any setting would be able to take the knowledge that about pelvic floor and pelvic health and universally use that just with all their clients. So I am glad that so many students are getting more in schools lately, and just I know I've like guest lectured at Xavier 2 times in the last year. I've got one coming up for University of Cincinnati next week. So just trying to get the word out there that, like, I mean, if you can keep this in mind going into practice, man, how much better off would our patients be? So yeah, my answer is everyone. Everyone should join. Everyone who's an OT should like step in once in a while.
Spot on, Rocky. I love that. And thank you for being a part of the co-chair of the post-jobs task force through the AOTA, yes. Which will be at the Conversations That Matter at the AOTA conference. So we are going to be putting some things in the comments today, not only our introductions to ourselves and all of the people joining us today. Thank you for being here. Let us know skiing or snowboarding. Also let us know about you. But we're going to include the information for all the pelvic health topics that are going to be presented at conference, as well as the meetup, such as the Conversations That Matter that Rocky's going to be at. So thank you so much for that. We'll also include the link for how to get on the survey enrollment so that you can join us and express interest in being a part of this community of practice. So we'll throw that in the comments as well. So Tiffany, you are an incredible mentor and were such an inspiration for me getting in this field. You have been in pelvic health for over 20 years. And I'm sure I'm not alone in saying when I found you, I knew I could do this. And I'd love to hear a little bit about your journey in feeling like a lone OT in pelvic health for so many years.
Sure. So I have been around a long time. 28 years as an OT, but 20 in pelvic health. It would have been 28 if I would have found it sooner. But I got into it because I was doing biofeedback on the whole body. And then one of my coworkers was like, you should do the pelvic floor. And I'm like, I don't want to do that. And then when I spent time with her and I saw the big impact she had on those clients, I thought I can do that. And that I feel like I make more of a difference in the pelvic health arena. I went to probably one of the first Herman and Wallace courses, PF1. I mean, I don't even know when that was, but it was probably 18 years ago or something. But it was difficult because at one that I went to, I was the only OT in a sea of 50 PTs, and they're like, why are you here? I was questioning a lot. At the time, I was a young therapist, and you know, I was like, oh, you know, why am I here? You know, now I'd be like, I can tell you why I'm here, and you know, be confident in saying that. But I didn't know, and I kept questioning, should I be here? Because everyone's questioning me. And so just course after course, always being the only OT, and then meeting up with my teaching partner, Jane Kaufman in Vermont. She's a PT, and both of our mentors were OTs and PTs. So we started teaching together. And we started with 5 come into our courses, and then it just kind of grew and just seeing it grow, and I'm always fighting with all these other professions, and then finding, then Lindsey came to the course like 10 years ago. And then I got a lot of passion from her because she just like took the ball and would roll with it. And I didn't even know the Facebook communities were existing. I'm like, oh my gosh, I just found my tribe. And it's been a great platform to say, hey, quit questioning yourself as OTs. We can do this work. And the more we question it, the more the PTs are questioning us, the more other professions, physicians are questioning us. 100% you can do pelvic health. Stop asking. Just do it. I promise you can. I've done it for 20 years. We're all doing it here in this group. It is very important that people understand that. And I think now that I'm starting to teach at university level, the next week I'm so excited. I told my students, supposed to be orthopedic class, and I said, hey, I'm going to practice my AOTA 3-hour workshop on all of you. It's on bladder and bowel health and OT interventions. And they were just like, oh, so excited. And that's, 47 students that can tell other people about, and I invited all the other faculty because I want this to be part of curriculum. So it's just a matter of, it is getting so much better. I did feel like a lone person out there in the middle of nowhere. I've been an AOTA member for 28 years. My dad and my mom are both, OT. My dad was president of Texas OT and real big OT when he was alive. So I've always thought membership was important and felt like I was an advocate for it. So I've gotten a lot out of being an AOTA member. I've been to all the conferences that I could go to. There are a lot of benefits. And I think this community, it's important because that's where we make a difference. Like if we want to be involved in legislation, it's not going to be us in our little Facebook groups. We have to have the backing of a huge organization. So I've been with the Women's Health COP for the past 4 years since the beginning, and I have seen the things that we can produce. And so this is a great way. I really encourage you to join AOTA. There's a lot of benefit, and also being part of these groups, we can make a big difference. So that's something I hope that we get across today.
Tiffany, we were talking about the logo for the t-shirt that we may design for the upcoming summit and conference. And I think you just said it. Stop asking. We can do this. I love that.
Stop asking. Stop asking.
Phenomenal. All right, Kimberly, Sarah, I would love to hear from you on why is this COP important to have now? What's the relevance now?
So thank you for having me here. And I would like to answer that question with a story that I was talking to Lindsey about, and I thought really illustrated why it is so important to have these communities, and a community like this that is not, I love our Facebook community. I think it's amazing and it's grown and it's so strong, but there's nothing like having the backing of your professional organization to validate what you're doing. So to tell you my story as to why these communities are so important, I work in a hospital-based outpatient rehab clinic doing pelvic health. And I have a very strong relationship with the inpatient department, and acute care OT approached me along with the rehab director a little while back and said, we've identified this need in acute care. And we've identified a need among the postpartum population. And this population, while they're still in the hospital during this acute phase, they're not getting what they need. Their outcomes are not that great. And we just know that there's an opportunity here for occupational therapists to make a difference. And would you be willing to help us out and look for research, look for evidence, help us build this program? And at the time I said, my thing is outpatient, but yes, absolutely. I'd be happy to help. I'd be happy to support. Well, incidentally, about 2 weeks probably after that, I attended this amazing OTs and Pelvic Health Summit, where I spoke, but I also attended a lot of the sessions, and happened to attend a session on enhanced recovery after delivery, which was a session by a PT who is a huge, strong advocate for collaboration among PTs and OTs, and a huge advocate for occupational therapists addressing the postpartum population. And I literally thought in my head, this is our program. This is what we need to do. And so I took it back to the director. I took it back to the OT. who had identified this need, to Jasmine, who is just an incredible therapist, and got the full support of the hospital. They were incredibly impressed. The administration was incredibly impressed. And it's all OT driven at this point. So now they're getting the OTs trained currently as we speak. They're going through training and they're working towards implementing this program. And I don't know that without this community that any of these pieces would have fallen together as beautifully as they did. And I'm very grateful for the community that I have, but I also recognize that by having this community of practice, that's just going to make this better. And that we're going to be able to connect these dots and connect people to each other so much more quickly and build programs like this that are so necessary to improve our clients' lives, to improve quality of life, and all the great things that we do.
Oh, Sarah, you said that so beautifully with that story, because it's all about those collaborations. And the more that we can meet each other and make these connections, not only do we as professionals grow and continue to learn, but we're in it to serve our clients, right? And when we're able to partner like that, it is incredible. It is incredible the way that we can take off. So thank you for sharing that story. Quick shout out that this year's OTs and Pelvic Health Summit will be happening in person in August in Phoenix. So we hope to make those in synergistic connections even stronger by actually meeting face to face. I'm so excited about that. Kim, thank you for being here. We would love to hear some of your thoughts about having practitioners who perhaps aren't client facing full time. How, with them being a part of the new COP, tell us a little bit about how the skills that they have, perhaps in research, perhaps in teaching, how can their being a part of our this membership kind of progress this mutual goal of having more OTs in this field feeling supported?
I mean, you said it right there. The goal is to get the word out that we are doing this, that we can do this as OT, and to also put it back out there. I mean, Laura, you started out with saying, you realize you need to come back inward and support our OT family in doing this work, not just the outward facing and trying to say, yes, we can do this. And I think one of the really important ways that we do that, supporting our inward facing group as OTs, is our external presence as well. So collaborating with those that are doing research that aren't maybe patient-facing, client-facing, to help and collaborate with those that are, to take that research, that data set that they might have, their clients, the progress that they make and the gains that they make, and put it out there in the scholarly world, so that we can then use that to promote policy and show on that academic level that this work is happening. I have students all the time that are interested in pelvic health, that want to get involved, and they go search the literature, and there's this much from OT, and then there's this much from PT, and then there's this much from nursing and gynonc. And so like getting that a little more established within that scholarly world. And I love that there are more and more OTs, and Tiffany, you just talked about your class, who are starting to incorporate this into their entry-level curriculum. It's not just something that you're going to only get post-school, or even the exposure to that this is an option for OTs. So I want to make sure that we're also inviting practitioners who may find themselves, like myself, in leadership roles, in research roles, in teaching roles. If you are passionate about this area, about public health, you are part of the COP as well, and it's really important that you're in it. Don't feel like if you're not seeing clients today that you can't contribute, because we really need everyone's voice involved. So very excited to be here among all the greats that are doing really, really good work in the field. Thanks for having me.
Oh, I love that. Yes, we need your voice. Please join us. Please be a part of this incredible movement. And I want to spend just a quick second kind of talking about the difference between the Women's Health COP, which has been in existence for 4 years now, our own Kimberly, as well as Mara, who had to step off for an appointment, were the champions of 4 years ago. And it's still such an incredible resource. But here's the thing, pelvic health serves so much more than just women. Right? And although this is such an incredibly important community to serve, we also can serve males, pediatrics, transgender and non-binary people, and so much more. And it goes beyond just a matter of women's health, right? And it's pivotal for us, for all of these communities to have a voice and to know they can be helped. I also think it's key for OTs to know that we can serve in these communities as well. It also enables us to go into more depth into pelvic health topics that may be too specific for a women's health COP. So I encourage us all to keep attending the Women's Health COP, but we'd love for you to attend ours as well. There are different meetings and are incredible ways to connect and grow our community. Fantastic. If we have, if you guys are able to stick around, if you have any questions for anyone in this team, please put them in the comments. We've got a bunch of great comments coming in. Carlin Riom is here. She's saying such a powerhouse group of OTs. All of this work is inspiring. Everyone, amazing work, everyone. Incredible. Absolutely. Awesome. Thank you so much for being here. I think this is one of our broadest attended lives ever. This is incredible. Mostly people join on replay, so it's such an honor to have you all here. And if you have any questions, throw them in the comments. And while we're waiting to see if that's possible, if there anyone else want to mention anything that's on our panel here today before we sign off?
I think potentially just to encourage people to come join us and celebrate at conference this year. If you don't have your tickets, get them. And really just excited to just appreciate all the hard work that we have done month over month for this past year, and excited to kick this off and start to really meet and organize. And, you know, just as Mara outlined, that a COP isn't specifically for research or for advocacy, but certainly we are going to network. We're going to be a headquarters, and those are all priorities for this group. So
fantastic.
And then conference, the rates are going to go up on March 1st. So if you are interested, get your registrations in soon. So save some money.
Yeah. Kara's wondering how we find the group on the AOT website. Are you talking about our new COP, Kara? If so, let me go ahead and pop in right now the URL to join. It's called the Pelvic Health Community of Practice Enrollment Survey, and it's kind of how the ball gets rolling in terms of being able to, okay, perfect, she says yes. So this is where we'd love for you guys to sign up. And it just kind of, we're going to then have an open house, and after that open house happens, we'll have a chance to talk a little bit more about actually how we'll be moving forward with creating that community.
And just to note, so for the open house, you do not need to be an AOT member to join, but then moving forward after that initial meeting, you will be encouraged to be a member and to be able to continue to participate.
Fantastic. All right, so we put the link for the enrollment survey in the comments. We're also going to throw up the list of all of the pelvic health topics that will be at conference this year, as well as information about our meetup, which we can't wait to see you all. A big thank you to this incredible team for pulling this together. Each and every single one of you were such an incredible part of this. So inspired by each and every single one of you, and to our community at large. Thank you so much for being a part of this, and we hope to see you at conference.
Thank you so much, Lindsey, for putting this together.
Absolute pleasure. Thank you.